Welcome to Caucus. I'm Steve Adubato. You know, caring and empathetic doctors are absolutely crucial to the healing process. Joining us here in the studio to discuss the importance of humanism in medicine are Dr. Richard Levin, President and Chief Executive Officer of the Arnold P. Gold Foundation, Dr. Leah Kaltman, who is a general internist at the Summit Medical Group, LeAnne Roberts, who is a medical student at New Jersey Medical School, and finally, Dr. Ravi Munver, Vice Chairman of Urology at Hackensack University Medical Center. What is the foundation for those who don't know it, and why is Arnold Gold a giant in this field?
Well, Arnold and Sandra founded this in 1988, as you know, and he is a world-famous pediatric neurologist at Columbia Presbyterian. And he began to notice that the trainees who he was responsible for, and residents and his faculty were beginning to be seduced by the rise of technology and forgetting about the connections which are so critical to delivering optimal health care.
The human connection.
The human connections.
Between doctors and patients.
Yes, and now we'd have to say between all healthcare providers and patients.
When you add the humanistic component with your patients, it changes the relationship and the way that you're actually viewing your patient. And you're taking away that aspect of only looking at the patient from the point of their disease or their condition, and actually as a human. And I think that's an important teaching point for medical students and residents and attending.
The problem, easy to fall into, is thinking that you are treating a disease rather than a patient.
I think in every specialty of medicine, compassion does build trust and confidence. And it's a matter of a doctor unraveling, taking the time, acknowledging symptoms, but unraveling beneath what a patient may physically show outward signs of. The time that it takes to really understand and sense, have that sensitivity and sense what may be emotionally affecting them as well, really is a quality which we need to integrate and maintain with all the sophistication of technological advances. And it's a challenge, but I think with patients, they do look to that, have a partnership with a doctor, not for us to be too authoritative, but for us to be still professionally responsible.
The first 15 seconds of an interaction with the patient can make or break that encounter. So,
how so?
When you walk into a patient's room or walk into an office setting, shake the patient's hand, acknowledge their name, look directly at them, eye to eye, and don't look over the patient. Don't have the patient sitting on an exam table while you're standing up. Sit down, be at their level. Be at their level both emotionally and physically. And I think that makes the relationship off to a good start.
One of the things that we must defend is the doctor's time with the patient. So as insurance companies, the federal government, whomever is screaming for more efficiency,
yes,
there needs to be a stop beyond which we cannot go, because it's the next question you ask that's going to reveal the secret in the history that will allow you to make the diagnosis. Doctor interrupts the patient in the telling of her history after 18 seconds of conversation.
Because?
Because the way we have been trained and the pressures that you've just described of being under intense pressure to speed things up result in that interruption very rapidly. Thought process is, after 18 seconds, you've heard enough of that introductory commentary, and then you can hone in on what you think is going on.
I think that even not just coming up with a diagnosis, but just determining if your patient is compliant with medication. Let's say a patient comes into your office and you've been trying to treat their blood pressure for months, and their blood
pressure's issue, right?
Yes.
Okay.
And you've noticed their blood pressure has not gone down the entire time that you've been treating them. But every time they're coming in, you're chastising them for not taking their medication. But if you don't let them tell their story, you may not know that maybe them getting their medication means a $2.50 bus ride in Newark to go get their medication, and then paying for their medication when they may have to take care of their children or their mother or whatever other economic things that they have to worry about. But you may not ever get that out of them if all you're doing is pointing the finger and doing the talking and not letting them tell their story.
And we have to go back even further, and we have to talk about education K through 12 in the United States, and whether there is a place in the curriculum to teach the role of the patient. Make sure that every citizen has a voice in this circumstance when he or she becomes a patient, because 21st century healthcare is largely going to be team care, and many people believe that the patient will be the captain of that team in most circumstances.
And so let me ask you, can't patients also get confused out there on the internet, right?
Yeah. If you take a patient who, let's say, has had diabetes for a very long time, they may know a lot about their illness, and they may be very educated about what diabetes means to them. But the vast breadth and the scope of diabetes and its impact on other systems in your body, they may not have that understanding because they haven't had that training. But I think the information that is available electronically and that patients can get a hold of is, in a sense, empowering to that patient, and allows us to, and we need to utilize it more to allow patients to be really involved in their team decision and how their health care should be delivered.
I was thinking one of
Sometimes patients need that, a tight hug, tissues, a follow-up phone call to many of my patients.
What does that do?
It just makes me feel like I care, and I think they get the message that, I'm thinking about you. It's just very important to build that connection with patients. I see a lot of my patients not just as a patient. They're an individual. It's just part of, working with somebody, and it's touching to see how they're affected as well.
How rewarding is your work?
I love what I do. It's very rewarding to me. I think all of us here feel that way.
Is humanism medicine, does it work because of people like this? And/or you've got to get other people who may not be naturally so inclined to understand it and live it, both? Because there's not that many, frankly, there aren't, I'm sorry for embarrassing you. There aren't that many people who are naturally like the two of you.
Well, these three are exemplars, but the approach is that everyone should have this. And I'll tell you that it's the rare medical student who enters medical school without these characteristics,
Really?
these traits. It
So medical schools
absolutely
are
is.
looking for
They are
it.
they're looking for this in their admissions process, these certain personality traits and qualities in the process.